segment is sponsored by ARA Diagnostic Imaging.
Welcome back to We Are Austin. The heart is a common symbol for February with Valentine's Day, but it's also American Heart Month. Dr. Sandeep Shah with ARA Diagnostic Imaging is here with important information about your heart health and how a simple exam now can help save your life in the future. It's important information. I'm glad you're here to share it.
Nice to be here.
What exactly is it that you specialize in?
I'm a radiologist, so my specialty involves diagnosing diseases throughout the body. We use imaging tools such as CT or CAT scan, MRI, ultrasound, and X-ray.
So what exactly is CT calcium scoring, and why is that known as a heart saver?
CT calcium scoring is a diagnostic tool, just like the ones I just mentioned. Scroll through here. It's called a heart saver because it can potentially catch coronary artery disease, which is a potentially silent killer before someone even has symptoms of heart disease, specifically a heart attack. Now, coronary artery disease happens when there's plaque buildup in the arteries that supply blood to the heart. I'm going to show those right here.
Yeah.
So here's a picture of the heart. Coronary arteries, little squiggly red lines right here. And even though potentially significantly detrimental, this plaque buildup can be completely asymptomatic. Now, a heart attack happens when there is complete blockage of a coronary artery, hence the heart doesn't have the blood it needs to function.
Right.
All right. This can happen very suddenly, and someone can be walking around and not even know they have these symptoms or have this problem. Okay.
So how do you help diagnose those?
Well, before we get to that, I want to just point out one more thing, that it's really important to understand the severity of this. If you understand that the #1 killer of both men and women in the United States is coronary artery disease.
Yeah.
All right. So with this information, you and your medical provider can find out if your coronary arteries are dangerously clogged. All right. CT scan is safe, non-invasive, comfortable, and can provide this information very fast.
Okay. Right. So what do we need to know?
All right. So what's going to happen is when you go in, you're going to get a picture of your heart. The picture of your heart's going to show you the levels of calcium buildup and how severe they are. You'll simply lay down, like this gentleman is, on the CT scanning bed, and within a matter of minutes, you have your exam done.
Gotcha. And do you get a report after that?
You do. You do. And so what we're going to do here is actually look at some of the slides of actual CTs from coronary artery screening, varying anywhere from no disease to severe disease. This is someone with no disease. What you're not going to see, this is the heart, here's a coronary artery, what you're not going to see are areas of white. The white's going to indicate calcium, which is a plaque buildup in the coronary arteries.
So this looks good.
This looks good.
No plaque, okay.
Healthy heart. This is someone with mild disease. This is the white I was talking about. That's calcium, which is plaque buildup in a coronary artery. Again, mild disease, someone who should think about maybe some lifestyle modifications to prevent it from getting any worse.
There you go, you're a pro.
So this is someone with severe disease. All right, I think it's, well, the red circles help, obviously, but there's all these areas of white, and this is calcium buildup in the major coronary arteries. This is someone who is at severe risk of having a heart attack from coronary artery disease and may not even know it.
So what are your next steps after this?
So next step is you get this chart. This is the chart that radiologists use to determine the severity of plaque buildup. As you can see, it goes from 0, which indicates little to no risk of a heart attack from coronary artery disease, to over 400, which indicates greater than 90% chance of having a heart attack because of this condition.
My goodness.
And we give this information to you and your healthcare provider so you can make the decisions necessary to improve heart health.
And so who exactly is at risk?
The major risk factors are the ones listed here. It's going to be poor diet, obesity, lack of exercise, smoking, family history, and advanced stage. So the stuff we all kind of know about, you know, but if you have one or more, all these risk factors, it's worth talking to your healthcare provider about the benefits of obtaining a CT calcium scoring at Austrian Radiological Association. And I mean, really, it's $75.
Yeah.
It's low cost, and it can be a true lifesaver.
It may have a very long-term impact. So we can put information on the screen about how people can find you. You've got locations all over Austin, or you can head to their website for more information, or you can pick up the phone and give them a call and ask questions. Lots of extremely knowledgeable doctors, just like Dr. Shah, who are there to help you and talk with you. Thanks for being here.
Thank you very much.
And make sure you stick around. If you've